My recommendation to anyone who is selling 7-OH products right now is you should remove those immediately from sale because it is illegal to sell those drugs in the state of Kentucky.
We have new developments and a follow-up here at 5:30 to a story we first reported on October 23rd. Now a strong warning for vape shops and gas stations selling kratom across Kentucky. Dr. Stephen Stack, you just saw him right there, the longtime public health leader under Governor Andy Beshear, says it's now a crime to carry most forms of kratom, which has been advertised as an herbal supplement. Just last week, the Beshear administration moved to make the opioid-like chemical found in kratom a Schedule I substance.
As you heard, it's called 7-OH. The order effectively makes it illegal to sell, possess, or distribute 7-OH anywhere in the state. And 7-OH is a naturally occurring component of kratom, which is a plant native to Southeast Asia, marketed as helping with energy, mood, and pain relief. Well, the FDA has not approved it, and Dr. Stack says it's 13 times more potent than morphine.
But tonight, we're also talking to 7-OH advocates who argue this substance is essential for many people who are battling addiction. WHAS 11 senior reporter Isaiah Kim Martinez has brand new information since his first report.
Relief. I was very happy to hear that something is being done.
It's what Cassie Clifford of Louisville has been pushing for since her son was rushed to the hospital earlier this year.
And that second dose is what did it to him.
He survived after taking kratom, nicknamed by some as gas station heroin.
We are losing people to this
because it naturally contains a small amount of what's called 7-OH, an unregulated chemical in the United States.
But it is no longer legal to sell or possess 7-OH in Kentucky.
Cabinet for Health and Family Services Secretary Dr. Stephen Stack, well known for his COVID-19 updates during the pandemic, calls 7-OH a dangerous and addictive narcotic. He talked to me just days after Governor Andy Beshear announced his administration has moved to eliminate it from store shelves by classifying it as a Schedule I drug.
The fact that it is now a Schedule I substance gives law enforcement additional enforcement levers that they can use.
Most kratom products contain 7-OH, but many vape shops and gas stations have sold it at higher concentrations, in some cases on its own. Stack says authorities will first work to educate businesses to remove these products, but if they don't comply after that, he tells me citations or even criminal charges could follow.
We don't desire to cause hardship for businesses. That was not the goal. The goal was to get a dangerous chemical out of the population.
But some 7-OH advocates believe this crackdown is misguided.
I think it's a really unfortunate move, especially in a place like Kentucky that has really borne the brunt of the opioid and fentanyl crisis.
Jeff Smith is the National Policy Director for the Holistic Alternative Recovery Trust. It's a nonprofit that says 7-OH is essential for people trying to manage chronic pain.
It's a very unwise restriction that is probably going to cause more people who have struggled with addiction to opioids to turn back to street drugs, turn back to the black market, where substances that they get could be laced with pretty much anything.
Cassie Clifford, though, says the proof is in the people who have reached out to her since our first story aired.
Several of them have lost loved ones, fiancés, sons, husbands that are gone.
And what about those bottles we purchased specifically for this story? I asked Stack what we should do with them. He said, pour them down the drain. Now, Dr. Stack tells me it'll take time for Kentucky public health inspectors and local law enforcement to enforce this new regulation. Again, he says if you possess anything more than the pure kratom leaf itself or its extracts, you're likely in violation. By the way, in Indiana, kratom has been illegal since 2014. Guys.
Interesting question. You asked him, what do I do with this stuff?
So, right, because I mean, we had it for video, right?
So where's the pathway to Kentucky's moves on this? Is there a precedent out there on kratom? A lot of people are hearing about this kratom really for the first time.
Well, Doug, Connie, it's been fast developing across the country. It all kind of started, at least ramping up in July of this year when the FDA said don't consume 7-OH, which of course is in kratom. And then Florida followed suit, the state of Florida, in about August, I believe, where I think it was their attorney general had come out and said, we are making 7-OH a Schedule I drug, exactly what Kentucky is doing now some 3 months later.
Yeah, it's interesting that Indiana I mean, that many years, 11 years ago,
Yeah.
they had it already.
And they did, and it honestly hasn't been without an effort to reverse that. There are people who want to get it back to where things are in other states, which is more accessible, but those haven't panned out.
So they had the confidence in what Florida did, and they moved pretty fast here in Kentucky.
In fact, Dr. Stack literally said we've sort of followed Florida's model.
Oh, very
that
good.
says something.
All right, great
Thanks,
update.
Isaiah.
Thank you, Isaiah.